We know that in the isolation times of COVID-19, child abuse can be further worsened. So joining me now from the Children's Treatment Center are Beth and Natalie. Welcome, ladies.
Hi.
Hi.
All right. So first of all, let's talk right about that topic and how the effects of COVID-19 can certainly worsen the impact on children who are being abused at home.
I can launch in. So definitely, there's a increased stress in our community. So people are worried about their health and the health of their loved ones. There's financial uncertainty. There's social isolation, which may lead to increased substance use, reduced coping skills, and definitely contribute to higher rates of child abuse. Another stressor is just being stuck with your family day in and day out. We're doing a lot of social distancing and isolation of families, which may exacerbate any underlying maladaptive communication and behavioral patterns in the home and contribute to increased risk for child abuse. Another problem is just our typical outlets and escapes are gone. So children aren't going to school, they're not getting out to their sports, they're not going out to community activities, and they may be just spending much more time with an abuser when they used to be able to, at least get out of the home and escape for certain periods of time. As well as there's a lack of recognition of abuse with everyone socially isolated. The typical people that would be contacting the Children's Aid Society or the police with concerns aren't not seeing the children. So extended family, teachers, coaches aren't seeing the child and able to pick up the warning signs of abuse and be able to report them to the appropriate authorities.
Absolutely. And another issue, of course, is in terms of victims of childhood abuse or survivors of childhood abuse, in terms of the triggers that this time in terms of isolation and other stresses can certainly impact on the triggers. So why don't you tell me a little bit about that, how that would affect, especially when counseling is not available?
Well, all the changes related to the crisis of the COVID-19 can be very destabilizing for children and teenagers. And it can bring on a low sense of security and safety, reminiscent to past abuse. The unpredictability of the situation and the uncertainties can also trigger a low sense of self-mastery and control, and along with feelings of powerlessness and helplessness, again, triggering feelings reminiscent to past abuse. As a result, some survivors will start to their trauma will start to be reactivated, and we can see an increase in symptoms such as flashbacks, upsetting memories and intrusive thoughts, sleep disturbances, hypervigilance, difficulty concentrating, negative emotions like anxiety and depression as well. And some will even resort to power-based coping strategies in an attempt to try to regain a sense of self-mastery and control. And sometimes those maladaptive coping strategies are like aggressive acting out behaviors or self-abusive behaviors as well, to try to regain a sense of mastery and control. We do, on the other hand, have survivors who will use healthy coping strategies to try to manage and regulate their emotions through this crisis situation.
Excellent. So that's a perfect segue. Let's talk about some healthy coping mechanisms that people that are in the situation can use.
Well, survivors need to take care of their bodies. So eating healthy, getting enough sleep and exercising is very important because it can reduce the negative emotions and just improve general mood. Survivors also need to take care of their mind by trying to maintain some consistency, by keeping up with a routine, by trying to practice some mindfulness skills, meaning training their brain to sit and stay in the present moment. Because if we think about upsetting thoughts of the past, the negative emotions will come along with it. Or, if we think about the future, the worries will be associated to it as well. So practicing those mindfulness skills, and also distracting their mind by doing fun, self-soothing, nurturing activities like doing arts and crafts, playing family board games with the family, reading, listening to music, whatever brings them some nurturing and some self-soothing. and also choosing to see the positive from this situation. And for younger children, parents may need to help them find those activities, and parents may also need to help children express how they feel, and reassure them on those feelings that things will be okay. And finally, connecting with others is very important. Trying to maintain contact with family and friends, either through phone contacts or electronically, like seeking that support and comfort when needed, and also reaching out to help phone lines or crisis lines if anybody starts to experience self-harming or suicidal thoughts.
And you mentioned, of course, the role that parents have to play in this. So what are some things that loved ones can do, whether it be the parents or even younger or older brothers and sisters, in terms of supporting their siblings if they're going through this?
There's lots of things that can be done. Obviously, Natalie mentioned a lot of things that an individual can do for themselves, and including things like a predictable schedule. And that's really helpful. It seems like a simple thing, but with so much change and loss that's occurred during the COVID-19 crisis, just having that regular predictable schedule that parents can implement for their children, or siblings can help kind of maintain in the home, helps give some normality and structure to the day. Another thing is just parents managing their own anxiety and stress levels by implementing their own self-care strategies, getting adequate sleep, trying to manage alcohol and or drug use, finding their own outlets such as exercising and connecting with their own friends. We all have to take care of each other, but the best way to take care of each other is taking care of ourselves as well, making sure we're healthy and we have the coping resources ourselves to deal with other people in our family that might be in duress, or other people in the community. Another thing is just making sure that everyone does get some self-care time, that they are not always together. I know it's we want everyone to reach out and connect with friends, but we also have to recognize that some people in our community don't have large living conditions that they can spread out from each other. So trying to ensure that people do get some time, if they need to have an hour in their room just to get back to themselves and think and be calm, and that's okay to let people have some time to themselves. Another thing family members can do is limit some of the consumption of COVID-19 related news. Children and adolescents really need to know enough to understand the rationale for the safety precautions, but really no one benefits from being inundated with those negative messages and negative headlines all day. It really can cause a lot of duress and stress for the children. And the other is just being a little bit more understanding, trying to, we all are going through a lot, and especially if a child has suffered abuse and this is triggering different feelings for them, that definitely, understanding that their behavior may be a little bit out of the norm right now, not coming at it negatively, really trying to wait until they're calm, and during an undistracted time, gently ask them how they've been feeling, and try to respond to those outbursts in a calm, consistent, and comforting way, and really helping and facilitating their ability to reach out for help. If a child needs to contact, Kids Helpline, or they need to access resources in our community to really to facilitate them. I know, not all children have a phone or the ability to do that on their own. So helping them identify those online resources or phone resources. I know the school boards have put out a lot of resources to families to contact, and allowing people to really make use of that as needed is helpful.
Absolutely. And just to finish off, let's talk about the importance, of course, of disclosing if someone's being abused, and of course the help that's out there, accessing services. Unfortunately, the treatment center had to close down for a month or two due to COVID-19, but is now reopening its doors to help children in our community. So talk to me about that.
Well, even though we were closed, we're reopening next Monday, June 8th. But a few weeks after we closed, we still we still were reaching out to clients just to talk to them over the phone and do a check-in and be of assistance to them. and clients were aware that they could contact us on a weekly basis as needed. And with some of the clients, I've been talking to them every week since then, but we're really looking forward to opening on June 8th. Clients will be able to resume counseling, and I think it's important because we can, this place can be a safe space for them to continue working on the impact issues related to their past abuse, and we can help them resolve those issues as well.
Absolutely, and it's certainly reassuring that the Children's Treatment Center is there to help children in our community who have experienced the horrific things, and of course reassuring, of course, that the treatment center was still there in some capacity for its clients. On that note, I'd like to thank you both for joining me once again and enlightening our community on the work that you're doing as well as on the situation as a whole.
Thank you.
Thank you.